Determining what resources you are going to use to help improve your nurse educator performance in the classroom is an important step. We only have so much time, and we can become easily overwhelmed if we look at too many resources. The first step we want you to take is to make sure you have Billings and Halstead on your bookshelf. Now, we're in the 6th edition still. All right, so this is the 6th edition, but the 7th edition is available. And what you want to be able to do is access this information easily. If you already have a relationship with the textbook vendor, which is Elsevier, then just reach out to them and ask if you can have access to a digital copy. That's a great option. And if not, then order the copy for yourself. You want to make sure that you are looking at what the evidence says about the teaching practices that we're using every day in our classroom. Now, if you're on the journey to C&E, this is an absolute must have. We call this our Bible when it comes to determining what specific concepts we focus on to help ensure we close our knowledge gaps. So speaking of knowledge gaps, the next step you want to take is make sure you have printed out your handbook. Okay, so if you go to the NLN website, you're going to find the candidate handbook for the C&E novice, and C&E clinical. We have the blueprint, the exam blueprint. That's what guides all of our curricular content that we develop for our snapshots, for our master class, as well as for our monthly boot camp sessions. Okay, so any content we develop, we use Billings and Halstead as our Bible, as our guide, and then we align it with the competencies and sub-competency statements that are listed in the blueprint. And then the next resource you want to have in front of you is your study worksheet. Now, if you haven't printed that out, it's okay. A piece of paper will do. Okay, so keeping a legal pad nearby is always a great option too. When we actually write down content, so keep your pen handy too. When we actually write down content, research says that we are at least 50%, some data says even 70% more likely to retain the information. There can be a lot of competing parties. There can be a lot of noise going on in our academic setting, and our ability to focus on concepts is going to help us become a better nurse educator, help us achieve certification, help us maintain our certification is a really important part of the journey. Welcome back, everybody. I am Dr. Sellars. If this is the first time that you are tuning in, welcome. We are glad to have you. Dr. Sellars Educate, our mission is to support all nurse educators until they achieve certification. Primarily, we focus on C&E, but we also offer the CHESI certification as well. All right, and then one more reference that I want to bring into our conversation, which is our study workbook. Now, some of you may have this. If you don't, I encourage you to consider it if you're on the C&E journey. Now, what colleagues tell us is that it helps compress time, okay, because what is included in here is an actual guided process as you move forward, specifically looking at those key areas. Okay, so we've identified 6 key areas in our content page to make sure that you stay focused on the primary areas that many nurse educators struggle with. And then the next resource is the 7-week study plan. Now, this is an excellent resource. It actually maps out specific content areas that's aligned with those nurse educator competencies to ensure you stay focused. All right, and then we're going to go ahead and give you the reference for our time together today, which is Chapter 6, focusing on the introduction to curriculum development. Now, there are several chapters, including Chapter 7, that gives you those philosophical foundations for curriculum. So there's many chapters aligned with curriculum, but Chapter 6 is where we want you to start. We're continuing our conversation and looking at what are those 12 biggest mistakes that nurse educators have shared with us that they struggle with, that they have had to overcome as it relates to their journey to become a nurse educator and to continue in their role as a nurse educator. We're going to start just like we always do with our thought-provoking question, just in case some of you have not seen it yet. We want to go there now, and you're going to hopefully follow along with us as we look at what our 9th biggest mistake is. But before we go there, we are going to just do a little bit of a recap, right? So stay with me while we do a little bit of a recap related to our ebook. Okay, so we first started talking about number 1, not establishing clear goals. Number 2 was being overwhelmed and overloaded with responsibilities. It's okay to say no. Okay, you've got to make sure that you understand from leadership whether or not you have a choice, okay, in some of the assignments and responsibilities that you have. Number 3 was ignoring classroom management strategies. Number 4 was failing to build relationships. Number 5 was underestimating the importance of communication. And this topic actually ties into our discussion today as well. Number 6, not making that important time for professional development. We want to invest in ourselves, and we do that by showing up to identify evidence-based practices and to collaborate with colleagues to help us become a better nurse educator, more effective nurse educator, and to have more joy in the work that we do every day. Not seeking feedback was number 7, and number 8 was trying to be perfect, which brings us to our topic today, which is focusing solely on content delivery. We started talking about the resource that you're going to use for a reason, and that is related to curriculum. We want to make sure we're aligning our curriculum with our learning objectives and integrating innovative teaching strategies to keep our students engaged. Okay, so when we focus solely on content delivery, the mistake is that concentrating exclusively on delivering information is going to overlook the importance of engagement and creating those meaningful relationships with our students. So a solution is engaging strategies that are going to involve the students in the learning process. This aligns with what's called brain-based learning. The more that we are engaged in the learning process, the more likely we are to learn and really advance those critical skills such as clinical judgment to help our students stay connected to the content. All right, so you probably guessed some of those specific active learning strategies that really help our students stay with us so we don't leave them behind as we move forward on the journey. All right, so now we're ready to go to our content that is related to our thought-provoking question. All right, so let's take a look together. So if you are on the journey to C&E, what you want to remember is that these thought-provoking questions are exactly that. They are designed to stimulate thought so that you have a clear understanding of what your next steps are going to be related to our content. Professor Kim relies entirely on lecture-based teaching with minimal interaction, leading to poor student engagement scores. What approach should or could Professor Kim take to better engage the students? A is integrate active learning strategies like case studies. B is to shorten the length of lectures for better engagement. And C is test students more frequently for comprehension. All right, so I'll let you take a moment to think about those 3 options, okay? So first step, when you get to a question on the C&E exam, is you want to ask yourself, what is this question truly asking me? And second of all, what is it that I know for sure about content related to this question? When you get to the exam, you may determine that, you know what, there's 2 good answers, and that may be true, but there's only 1 correct answer. Okay, so you want to think about what is this question really related to in regards to the content that is being questioned. All right, so go ahead and write down what you think your answer is, and we're going to go through our content, and we will wrap up our time together by looking at the correct answer and then talking through a little bit of the rationale as well. All right, so now as you kind of put your thoughts together about the content that we're going to talk about today, a really important step is making sure that you have done your self-assessment. Okay, so let's talk about that a little bit while I pull up the content. When you're doing your self-assessment, you're identifying where are you today related to concepts on the blueprint. Okay, going back to where we started. So when you look at the NLN blueprint for your respective exam, you're going to see some specific information about statements. Sub-competency statements is what we call them, but they are behaviors, okay? So for the C&E exam, this is the blueprint for the C&E exam. There are actually 63 sub-competency statements. So you're doing your self-assessment to determine exactly where are you on that scale. We talk about a 1 to 5 scale. But ultimately, we want you to go through and circle, highlight, put an asterisk by any content that you're not at least 70% competent about. Okay. So, in other words, you feel 70% of the time you would be able to answer that question correctly on the C&E exam. If you're below that 70% threshold of confidence, then we want you to circle it. Okay. Because that's going to allow you to stay focused as you move forward on your journey. And if you're not on a C&E journey, it's still important information, right? Because remember that these are competencies, not only for the C&E exam, but they are designed to really help us stay aligned with those evidence-based practices that we are expected to demonstrate in our learning experiences with our students. Effective content delivery, this is all about how do we keep our students engaged in a way that allows us to master that transference of knowledge. We want to enhance the engagement with our students. Their ability to connect with the content allows them to retain information more easily. So here's a question. What innovative teaching strategy can help you shift from content delivery to a deeper student engagement? So what specific teaching strategies do you want to use to help you make that shift? Okay, so you're writing down on your paper or your study worksheet, what are some of those strategies that you feel like could help increase student engagement? So let me give you an example. Oh, in chapter 16 in Billings and Halstead is going to be a reference if you are not sure exactly what those innovative teaching strategies might look like or how to implement them. Maybe you know case studies should be used because we've already talked about it, but you don't know exactly where to start. The good news is our textbook vendors, they have already, and other vendors as well, they've done a great job of really creating great case studies. So you may tap into your textbook vendor or other vendors that you already have a relationship with. So with teaching strategies, what you want to remember is that we want to create learner-centered experiences. Yes, we focus on our teaching plan, what content we need to integrate, how we're going to deliver that content. And we have to consider what is it that is going to help my students best connect with the content. Could it be, as an example, preparing a thought-provoking question at the beginning of our class time together? You all know that's a practice that we follow. Or maybe you have developed a ticket to class that's going to allow learning to start even before students enter into our classroom. All right, so those are just two examples. We want to create this environment of intrigue, right? Of excitement, just like you could see this young lady is excited about what's in the box. Well, we want our students to be excited about the learning process. We know in nursing, there's a lot to teach. The more we can actively engage students in that process, the more joy we're going to have, first of all, in our learning experiences. And number two, the more likely the student is to retain that information in a way that allows that scaffolding of learning over time to help them advance their knowledge and improve their clinical judgment skills. So number one, that interactive audience participation, we want to encourage feedback from our audience, right? Sometimes we get the nonverbal, but we want the verbal as well, because we want to know whether or not we're connecting the dots, whether or not we're landing our plane with the student in a way that they're able to carry out those concepts, carry out those decision-making steps in the clinical setting. The second consideration is through visual storytelling. So leveraging those images, tapping into students' clinical experiences to learn more about how they're connecting the concepts with clinical application that they are having with their clinical skills lab and simulation experience. And then we want to create personalized content opportunities with our students. Again, we can tap into the clinical experiences that students are having. We can create small circles, just like you see in this image, where students are able really to share what their experiences have been like. Let me give you an example. When it comes to the first code situation or patient decline that a student witnesses, it can be overwhelming. It can be frightening, okay, and alarming. And so we want to allow debrief time with our clinical experiences so that students have a chance to kind of think through their personalized experiences in a way that decreases that fear, right, that anxiety, and empowers them with knowledge and expertise about what happened with that specific patient and to reflect on whether or not anything could have been done differently. And of course, to celebrate early interventions, early actions that may have been taken to save that patient from an adverse event. And then fourth is using media, right? We know gaming is important to connect with our adult learners. And we also want to remember just some good old-fashioned strategies, such as having students write down some of the core concepts that we're talking about. Using puzzles, right, is another great activity, something that many of us probably haven't done in quite some time. My students used to love crossword puzzles that I would create for them. Quizlet, we know, is another easy to use, easy to set up technology. So just think about what are some strategies that you can use that don't necessarily take a lot of time, take a lot of burden to build, but are easy ways to interact with our students that's going to improve communication and connection in a way that is going to allow them to advance their knowledge and competency. John Maxwell made this statement, and I thought it was very appropriate for our time together. He said, effective communication is the bridge that connects people and ideas together. That's what we are talking about in our didactic experiences, ideas that are connected with evidence. So our ability to really connect the dots for our students to help them bridge that theory practice gap relates to our ability to articulate information in a way that transfers knowledge and advances their clinical skills. Content retention is a really important part of the learning journey. 80% retention, that's our goal, right? We want students at least 80% of the time to walk away with a solid validation of their knowledge. And I want you to think about how can you make that happen? And then the second part you want to consider is, how do I know whether or not it's worked, whatever strategies I've implemented? We want to create opportunities for formative assessment. Now, having a 50% increase, I know that's a lofty goal, but it's something to consider when we can think about in Chapter 16, all of those wonderful ways we can engage our students. That's a strategy that we can use, right? So doing those formative assessments, having a benchmark for ourselves, maybe you start with the 10% increased interest, thinking about how we can monitor that and measure that with our students over time. C&E Review on the Go is one of those innovative, engaging strategies that we use to keep our colleagues connected with the content so they don't get stuck on their journey. If you all have heard my story before, you know it took me almost 8 years, yes, 8 whole years to finally get C&E off of my bucket list. It would not have taken me that long if I had access to a review app, if I had access to the exact resources, the exact pathway to success. Well, I didn't have that many years ago when I was on my journey, and we don't want you all to struggle in the same way that many of us have. Okay, so that's why you want to consider C&E Review on the Go, so it's easily at your fingertips. So how are you feeling right now based on the content that we covered? Remember that our goal is also that you reflect on where you are today as it relates to this competency and these behaviors and where you want to be. So if today you're at a 2, we don't want you to feel bad about that. We're going to take a look at our thought-provoking question as well, and then maybe it will trigger you to have even more increased awareness about where you are on this journey. And then if you are at a 5, celebrate too, right? When you want to celebrate when you feel confident in your ability to demonstrate these skills that we're talking about. All right, so let's go ahead and go back to our thought-provoking question and let's see how you've done. Okay, so again, just to recap, you want to take a look at Chapter 16 as well as Chapter 6. Okay, so these are going to be great resources in Billings and Halstead to help you stay focused as you move forward on your journey. All right, so what's your answer? So if you all chose option A, you are correct. All right, so option A is the best answer because active learning strategies promote critical thinking and retention. It may have been a close second with B, but there's no evidence that says length alone equates to deeper learning, and also testing alone doesn't necessarily improve engagement, right? It's important for us to be considerate of the length of lectures because we know with some of our students, they have about a 10-minute attention span, some even less than that, right? That's why TikTok is such a favorite for many colleagues. That's why Reels are such a favorite for many of our students. And we want to be able to create meaningful learning experiences with our students without thinking about length. Okay, so you want to consider that. And then we want to pick up on those nonverbal cues. If we see our students tuning out, we want to integrate maybe a break, maybe a stand and stretch break, maybe a creative activity. Asking students to pull out the piece of paper is always a great strategy, right? Just say, okay, let's pull out a piece of paper and a pen, and let's write down 3 takeaways that we're going to get from today's lecture or today's experience. Or maybe I want you to write down one question that you have that we didn't cover, or maybe you're still unclear about related to a concept that we discussed. Our ability to create these innovative strategies really does help our students have a better understanding of concepts. We hope that this snapshot has been helpful. Reach out to us if you have further questions. info@drsellarseducate.com. We look forward to seeing you in our next snapshot. And we also want to make sure that you take some time to access the ebook that is available. Okay, that's right here in the description. And we look forward to continuing on this journey to explore not only the mistakes that many of us nurse educators make as we become a new educator or as we continue in our role, but we also want solutions. We will see you in the next one. Have a great one, everybody.